All right, well, wouldn't it be great to look as good on the outside as we feel on the inside? Dr. Patti Flint, board-certified plastic surgeon, is here today to help us figure out what we should do. We've got the rejuvenation that might be a solution to our problem. Welcome back to Sonoran Living.
Thanks, Sandy.
You know, I was talking to you in the green room, and you're just full of such great information, and I can't wait to share it with the viewers because you're really going to help us out so that we don't have to go under the knife, maybe not yet.
Sure.
Okay, so how do you know if you need to go under the knife or if you need a facial rejuvenation? And what is a facial rejuvenation?
Well, there's many different types. I think really today I'd like to talk about some non-invasive options that don't require surgery.
Okay.
And I think there's really no such thing as too early to start, particularly with topical skincare, and it really gets overlooked. So I'd like to talk about that.
Okay. Well, let's do it. Minimally invasive. I mean, you don't go under the knife. How does it work? What is it?
Well, I think everybody should be on quality skincare, and unfortunately for most people it gets very confusing as to what to buy over the counter. The sad truth is most things that are sold over the counter actually are not very effective. So we spend a lot of money, a lot of time, and we really don't see the benefits. So I think it's very important to meet with a plastic surgeon to talk about quality doctor-prescribed skincare that has been scientifically proven to make a difference.
Okay. So let's talk about some of that skincare. What are the things that you need to do or get from a certified plastic surgeon that you can't get over the counter? I mean, there's a big difference.
There is a huge difference, and the main thing is the FDA doesn't allow over-the-counter products to have enough active ingredient to do anything. So the line I have in my office comes from SkinCeuticals, scientifically proven, and there's no doubt that it has an efficacy. It improves the appearance of your skin and the health of your skin, even prevents skin cancers. So I think it's really something we all should be on early. But additionally, as far as non-surgical options, there's this catchphrase going around, liquid facelift.
Right.
And what that really means is utilizing non-surgical options to improve the appearance of your face, primarily with injectables such as Botox and filler. And patients get very confused about the differences between these therapies. So I wanted to go into that a little bit just to clear up some misconceptions. So Botox, for instance, has been around for a long time. Most people are fairly familiar with it, but really what it does is relax muscles in areas that when you animate your face or make an expression, make you look angry, tired, or older.
Because we hear about the angry mom, right? That's sort of right there.
Exactly, and that's a great target for Botox. But my issue is that I always want patients to look natural, and so I use low-dose Botox. So you can still move your face, and you don't look like maybe some of the people we've seen that look a little frozen. I'm really not a fan of that appearance. So low-dose Botox really prevents those lines from getting deeper and being there even when your face is relaxed. So it's better to start a little earlier than to wait until they're there all the time.
Now, you said that there's some things that you shouldn't do or that really don't work, because I'm sure there's, I mean, I even came to you and I said, I think I'm going to get this done, and you're like, don't do it.
Right. Well, I think Botox and filler are excellent tools, and I use them in all of my facial rejuvenation patients. But there are a lot of gimmicky things that are out there, and as a non-medical consumer, it gets so confusing, and people spend lots of money on therapies that just really have never been proven to have any benefit. For instance, a lot of the topical laser therapies, such as Thermage and Fraxel. To be perfectly honest, I think they do little more than a deep facial, and they're quite expensive. Certainly neither of those therapies will elevate skin that's sagging. So if you're standing in the mirror doing this, forget about those non-invasive treatments. That's when it's time to consider surgery.
Do you know how many people just touch their face right now and went like this?
I believe it.
Well, and you know, coming from you, I mean, definitely a professional that's excellent in her field, for you to say, doesn't work, I wouldn't do it.
It's not that it does nothing, it's that the vast majority of patients that see me would expect a better benefit than what they get for their time and finances.
Okay, well, let's let everyone know how they can get a hold of you, because you do believe in looking natural, and that's what you want.
Definitely.
Okay, so here you go. If you would like to go see Dr. Patti Flint, she has 2 locations, one of them in Scottsdale, right near Old Town, or in Old Town, off of East 2nd Street, 7301. And then also in Mesa at 1520 South Dobson, and that's Suite 218. You can call her at 877-91-FLINT. That's pretty easy to remember. And you know what? You can go on her website and look at some before and after pictures. Those are amazing. At pattiflintmd.com. So there you go. We really appreciate you being here. Thank you.
Thanks, Andy. It's a pleasure, always.